Hi guys, welcome back to another episode of the Column Podcast. I'm your host Renat, and today we have our co-host Ratish.
Yeah.
So today, as you can see, there's a third screen there, and that's our special guest for today's episode. That's Dr. Akram. Hi, Dr. Akram. Thank you so much for joining today's episode.
Hi, thank you very much for inviting me to the program, guys.
Yes,
Yeah,
it's a
it's an
pleasure. It's
absolute
a
pleasure.
pleasure.
It's an absolute pleasure to have you at our podcast. So before we continue, I'll give a small description as to what Dr. Akram has accomplished and what he is basically. And he's a consultant anesthetist. Did I say that correctly, Doctor?
That's true. Yep, that's
Yes. All
perfect. Yeah.
right. I botched it the last time when we called it. I think I said something else. He's from the UK. He has his,
Anesthesiologist. Yep. Yes.
I think that's what I said.
Yeah.
That's what I said. So he's the host of the Health Talk with Dr. Akram on Ion TV and Sky Channel 782. So if you guys want to hear more from this show, if you want to see more clips, we'll link the YouTube channel to that on the links in the description.
Yeah. Check out this description.
Yeah. So Doctor, have you been talking on the show recently? Have you gone on the show, like on your show?
Well,
recently?
I have every Thursday my regular shows on television on Sky Channel 782 Ion TV. So
Okay.
where I bring, like you guys, special guests every time, and we talk about different medical subjects. We've been doing lots of medical subjects for last few weeks. I've been doing lots of diets and exercise-related stuff
Okay,
because that's the time after Christmas, New Year. People been eating a lot and yeah, looking after their health.
It's
Absolutely.
important. So.
Nice. I had a look at a few episodes as well. I think me and
Me too,
Ratish had a look at hernia.
Yeah, me
I
too.
think,
Sir.
right? We had a
Oh,
look at it.
excellent! Yeah, hernia. Yeah, I did some programs on YouTube because a lot of people ask for small programs. They especially targeting people like hernia. Somebody asked me, and there was some other programs I did for women on breast self-examination and mammography, where you can detect cancer quite early and you can get treatment. So that's quite effective way. And there was something on women cancers as well, and vaginal cervical cancers, how to detect them early. And yeah, these programs been asked by my viewers, and they send me messages. So I quickly read them, give them a small video, so in short time they could grasp enough information.
That's great. So
Yeah,
that's great. That's great. That's very
absolutely
informative.
fantastic, right? Yeah, it's great for especially like the woman. It's like a PSA for them essentially, and also for men if you talk about hernia and all, because these are information nowadays. It's the age of information, but still there's a lot of misinformation. So I think that's obviously a really good, I would say an outlet for awareness and knowledge. So yeah, so let's talk a little bit about anesthetics. So what is it, doctor? What is anesthetics? What do you do?
Well, anesthetics, what we mainly do is there are two branches in anesthetic, main branches. One is the anesthetic branch, and we also look after sick patients in ITU, intensive care units. So anybody who is really ill in a hospital, they are under our hands.
Okay.
So if anybody, yeah, so it's kind of that, and all the COVID patients who are ventilated and tubed and ventilated, the machines, they are under us. So we look after them. Or if anybody had a major surgery and they need to be looked after for a short time until they recover, they also be looked after in intensive care unit. And the anesthetic bit, what we do, we provide proper environment or pain-free environment for surgeries, where like you won't be able to operate on a person without giving any painkillers or anything.
Okay.
So making the unconscious. So our main job in the day-to-day work is like that, because there are lots of surgeries happening every time, and we take these patients and we provide them an agent to make them unconscious, give them enough painkillers, and provide them adequate environment for the surgeon to operate on them, and after that we recover them. So that's basically anesthetics, what we do.
Okay.
And
So what is the agent or like the gas which is pumped into the bodies?
well, There are lots of agents we use. They are all based on carbon and fluorine. If you think about it, it's called sevoflurane, desflurane, halothane. That was an older agent. These anesthetic agents, how they work is we provide it through a machine. That machine gives an adequate concentration according to what we dial there, according to the body weight and the patient's age, sex, and all these things. So these gases will go along with the oxygen and the carrier gases to the patient. The patient is ventilated and gases get absorbed in the lung and goes to the brain and make the brain unconscious. So it works in the brain exactly. And it make you unaware, but it will not give painkillers, but we have to give painkillers separated, like morphine or other opiates, we call them. We have artificial opiates as well. We could give them. They're very effective.
So if you are in anesthetic, like if you have been conducted in that, so you would feel pain still, yet.
Yes, if nobody was given a painkiller, you will still feel pain. So in anesthesia, that's the major. We call it anesthesia triad. So it is first analgesia is the pain relief part, amnesia, the making you unconscious, and the third one is the muscle relaxation. So simply all our muscles are toned. Like if somebody wants to operate on your tummy, they want to look at inside what's happening in your guts or something like that, you need to give muscle relaxation. Otherwise, the muscles are contracted, surgeon won't be able to operate properly. So that's why you give a muscle relaxation. And this works in your neuromuscular center, in your neuromuscular junction, and they block the signals which go into the muscles, and the muscles simply relax.
So like, how do you actually perform it? Like, how are the basic, like, how do you conduct them?
Well, when you come to an operation, what we do,
like most of your responsibilities are involved before the surgery, right?
Before the surgery, yeah. So we talk to them in the ward. We look at what kind of surgery they need and what kind of anesthesia need. That's basically for fit people. And of course, we have to consider if they have coexisting medical problems like hypertension, diabetes, or the kidney disease. All this will change the way of giving anesthetics, the amount what we give. So once we discuss, we bring them to the anesthetic room where we would give oxygen before anything. And we always have an induction agent called an intravascular agent, what we give that make this anesthetic part very quick. So once this drug is injected, it takes about few minutes and the patient will be unconscious.
Just few minutes.
Unconscious. Yeah, just few minutes. It's a maximum 3 minutes. Some agents can work under a minute. So it's that quick. So under a minute, and once they're unconscious, most of the time they would, if you given a muscle relaxant as well, they would stop breathing as well. So we have to assist them breathing. So we pass a tube through their mouth, and that will stay in your trachea on the throat. And with that tube, we should be able to connect to our machines and ventilate the patients during that period.
So doctor, like most of your responsibilities are involved like prior to the surgery and obviously after it. So what do you do in between? I assume you have to stay near it.
So what happens once we have given these agents? It's like a plane, right? It's when you decide to fly, it's not mandatory. If you like, you could fly. If you don't like, you can stay home, right? So anesthesia is exactly like that. But once you take off, that's mandatory. It becomes mandatory to fly the plane and safely land it. So anesthesia is exactly like that.
Yeah.
So once we agree with the patient, they're going to give anesthetics, and once we give it, that's the time all our major responsibilities start, because the patients won't be able to control their senses because we made them unconscious. Right? Yes. So we have to provide them oxygen, we have to make them breathe with the machines, and we have to keep them unconscious, give them enough painkillers, and we need to look after them throughout the surgery. And once the surgery is finished, we will switch off the anesthetic gases, and that wear off within a few minutes, and patient will automatically wake up.
Okay.
So once we wake up, we
Okay,
keep
okay.
them another half an hour to 1 hour in a safe place under the scrutiny of nurses who are trained, especially they call recovery nurses. They look after them until the patient is fully conscious, and they could drink a glass of water, they could have something to eat, or they could talk, converse, and that's the time we finish our duty there, and we send them to the wards.
All right, all right.
So
Damn.
this process, how long does it take in average? Like the complete process of it.
It depends on the operation.
Okay.
All anesthetics, to start an anesthetic, it takes about 5 minutes maximum, 5 to 10 minutes, depends. Then you could keep the patient unconscious any amount of time. So the smaller surgery, what we do can be about 5 minutes to 10 minutes operation, small jobs. And after 5 minutes or 10 minutes or so, we give accordingly the drugs which works short, and you wake them up. Or sometimes surgery, sometimes I used to do cancer surgeries, especially on the face.
Okay.
Those surgeries take a long time. So we used to start 7 o'clock in the morning, and we finished the operation the following day, 4, 5 o'clock in the morning.
The
So
following
you
day.
could see the
So how do you
following day.
take breaks
Ooh.
in between? Like
How do we take breaks? Well,
Yeah, there are no breaks, right?
most of our machines are well high-tech machines.
Okay.
There's an anesthetic machine. What we use is about 100,000 pounds.
100,000
It's more
pounds.
expensive than a Bentley, so you could imagine. So sophisticated
Oh my.
machines. It's got alarms, and it's got auto mode. It will function on its own, and it alarm us if there's anything go above or below the limit what we have set. So we put, once a patient is anesthetized, we put them in these machines, and the machine will look after. So we have to just sit down and watch them, basically. So during that time, of course, we can get another person to come and look after for the short half an hour or something, for us to go and get something to eat. And the surgeons also, when we have these long operations, we would stop for half an hour, like after every 6 hours, we would stop for half an hour. We cover the patient, and we'll leave the patient to rest, but only one person will sit down with the patient. Everyone else will go have food and come back and start again.
Damn, sir. Damn, sir.
Yeah, there's a lot of responsibility involved. That's
Involvement, yeah.
That's the yeah. That's the whole how do we say, gist of the job. Not just like if you take any
It
other
is a good
job,
job. It
because
is
it's
very satisfying
yeah.
in the end. It's
Yeah,
like,
yeah.
every day we do lots of operations, and then you get the results immediately. You wake them
Exactly, sir.
up.
Exactly.
Yeah.
That's the thing.
Like doctors are phenomenal, sir. They're like,
Yeah.
like seriously, like if you think about it, they're like the nearest God we can ever see. See, like if there's a God there,
Absolutely. Yeah.
It's
they're
not really, if anyone who studies and who wants to do a job as a doctor,
Yeah.
it's possible. It's not black magic these days.
Yeah, it's
Anyone can
yeah.
study to be a doctor, yes.
Yeah,
It's a bit difficult, but yeah,
certainly difficult.
it's
Certainly
possible.
difficult.
Certainly difficult, but possible.
Possible, yes. Yes.
Absolutely.
It is possible.
So Ratish,
Yeah.
do you have any more questions
No,
for
sir. Sir,
anesthetics?
yeah, he literally
I think
described it very.
yeah, I know, right? Very
It's so
briefly,
clean.
in a way
It's
we
so
can
simple.
understand.
Yes,
Yeah,
sir.
into digestible bits. So why don't you move on to the main event of today's podcast, and that is Dr. Akram has written a book. It's called Flying with Flamingos, if I'm not mistaken.
Yeah, Flying with Flamingos.
Yes.
Flying with
It's on
Flamingos.
Amazon too, right,
So
sir?
it's on Amazon.
Is it Amazon? Yes. It's been published for a while, actually. Yeah.
How many copies did you
has
sell?
it sold? Yeah.
Well, we have printed out 2,000 copies, and we have sold most of it in Amazon and book promotions in the UK and around the world, in Canada, UK. We've done in Sri Lanka and India, other places.
Okay.
But we have sold a lot on the Kindle downloads from Amazon. That
Kindle
was, sometimes I've seen like a few 100,000 copies being downloaded.
You had 1,000 copies. Damn, sir.
Yes.
200,000. Damn. So the first question that I had when I saw the title was, what is significant about the title or the name of the book, Flying with Flamingos?
Well, Flying with Flamingos, the book is based um, in the Sri Lankan war, the civil war we had for 2 decades, about 20 years. And well, I happened to work in Mana, that's in the northwest of Sri Lanka.
Yeah.
It's a small island. That was my first job actually after I finished my medical training. And in Romania, I studied actually. Then I came back to Sri Lanka. I did 1 year, that's called internship. I did in the south. Then my first appointment was in this place, Mana. So that was during the war. And so our hospital was built in between the Thaladi camp and the other side was the LTT area.
Okay.
So,
Okay.
so we were there, one of the first doctors to reach to Mana because the hospital had been closed for a long time. So, we have worked there during the war, and overnight you could see shell being sent from each one direction to the other. We could see the lights as well. And yes, it was quite frightening, but if I say the best part of my life in Sri Lanka, I had in Mana, it's not wrong. We had amazing time there. So those days, I had a really good chance to mingle with all kind of populations. So that was a war area. So they would bring injured LTT soldiers or injured soldiers from the separatist groups. And on the other hand, the military was also there, so they were quite our good friends. But as doctors, we were not allowed, that's our oath, to divulge any information from one side to the other side. We always kept it neutral.
You still served military as well as LTT people, sir?
Yeah, that's right. Yeah.
Okay.
Oh, right.
So we were working in a civilian hospital, right? So if a civilian's been brought injured, if that civilian does not tell us I'm a terrorist, and he is a civilian, right? So they never tell us. So we never ask them as well. So that's the way you treat patients, right?
Yes,
It's
sir,
anybody
yes.
you should give them the right treatment. So that's what we used to do. So police also and the military also, they never asked us, they never forced us to tell any information. So we were friendly with both sides. And of course, the separatist organization, they would never say that they take part of that organization. But of course, when you talk to them, you might understand. Well, so that the time I have seen lots of people who've been affected directly or indirectly by the war. And that was one of the place I started thinking about, that I should write down these things, what I have seen, what I've heard, the people I met in different part of my life. So before that, when I was a student in Romania, I used to meet a lot of people, Sri Lankan people from all different communities, Tamil, Muslims, Sinhalese, fleeing out of Sri Lanka due to this war. So Romania was one of the transit points. So where I have met groups and groups of people, they come to Romania through different routes from Russia, then they used to cross to Hungary, Austria, then Western Europe. So that was the path. So I met people and I've heard lots of their stories. I would love to, I like to listen to their stories. So that was the thing. So one of the nights when I was working in Mana, there used to be a nurse called Gunam. And he's one of the senior nurses from Mana Hospital, and the guy who worked throughout in that hospital. He used to say, "Doctor, when we were kids, we used to go to this lagoon area they call Kalapu. We used to go dip ourselves until our head level, and we used to put a pot on our head and makes 2 holes for our eyes and small hole to breathe, and we used to wait and wait and wait." And then that's the time, Siberian ducks or flamingos, they'll come and land on our head thinking it's a rock, and we used to catch them. So that was in my head. So when I wrote this book, I thought all my characters in that book, they wanted to fly away. So I thought that is a perfect match for the name, because these people all had problem in Sri Lanka. There was a main 9 characters. They consist from a LTT girl who was leaving LTT, running away from them, and there was a Tello boy from Eastern Province, because these people, I met them at some point in Romania. And there was the main character was from Mana. He was one of my classmates called Moidin, and they've been chased out of Mana by the separatist groups overnight. When the Muslims been chased out. So he was one of them who lost his mainland and his place and houses, everything. So overnight he became a refugee. So there was another military guy. He was working for the what's that called, the information unit, STF, right?
STF.
So he also
Yeah.
had to leave the country because he had enough of the war after that. So all these people been arranged by the agents. They had agents in Sri Lanka, and these agents put them in one group, said, okay, we're sending to Europe. And they all paid a certain amount of money. And they said, okay, you go to Russia, in a few days you will be in Europe, and that's over. So until you reach Europe, you have to work as a group. So that was the bound there. So even though you had all the differences, but you can't show any differences because this was an illegal operation they were doing it. So if they have any differences, that will flare up and they'll get into trouble.
These my dance make it hurt.